Welcome, everyone. Thanks for being here at the Advanced Care Planning poster. First of all, does anyone know what advanced care planning is?
A little bit.
Advanced care planning is something that allows patients to express their medical treatment preferences and select surrogate decision makers prior to a medical crisis. It's very important because during a crisis, people don't make the best decisions. One of the things that's really important is that between 70 and 95% of life decisions are made by family members. Half of the time, they don't know anything about the patient's wishes. That's dramatic, and that's because folks have not talked about what is important to them about their end-of-life care or something that would happen as in regards to an accident. So the tools for documenting advanced care wishes are durable power of attorney, and this is in reference to legal and financial decisions only, not health care. The next would be the medical power of attorney or health care proxy. And this is when a person selects someone to make medical decisions when the patient is not able to make the decisions themselves. The living will is a document that lets you state your wishes for end-of-life care in case you're unable to communicate your wishes and make them yourself. Also, we have medical orders which specify which medical treatments may or may not be administered and under what circumstances they may or may not be. There are things like the do not resuscitate order. Have you heard about a DNR?
Yes. Yeah.
The physician orders for scope of treatment, which is called the post. Medical orders for life-sustaining treatment or physician orders for life-sustaining treatment, the POST or MOLST, which are valid in all states but 5. This is an example of a POST or MOLST. Also, there are organ donation registries. In our state, you can have it on your license that you're an organ donor. Starting the conversation is probably the most important thing that you will need to do. Often patients are a little reluctant to have the conversation, but talk about what they want for end-of-life care. Do folks want ventilation? Do folks want hydration? Those kinds of issues are really important for end-of-life care. Make sure to recommend that they talk about their wishes to their physicians, particularly their primary care physicians, and that if they have the legal documents, that their primary care doc should have a copy of those in their records. They need to choose a surrogate who can honor their wishes, and that's someone who they trust. Most importantly, write down the wishes. At a time of crisis, even the most well-trained surrogate is not going to remember everything that you really wanted. Review the plan regularly. Review it with your patients. Also, pain management is important. There's also comfort care. People worry that with antibiotics that they may not get them if they get a pneumonia and they have a do not resuscitate. Not true. In comfort care, they can get antibiotics or any other medication that would help them be comfortable. And lastly, we need to address spiritual care. Are they part of a faith community? Would they want a clergy person to be at their bedside? Would they want prayers? Would they want songs? All those kinds of things are important to know about. Well, I hope that you've gained a little bit of knowledge about advanced care planning, and I hope it eases your own mind and your future patients that you will be able to have these conversations with them. Thank you.